Remember Beth, the young mom and business owner who was trying to purchase health insurance? Today we're going to follow Beth through her experience with Obamacare, the health reform that aimed to make insurance more affordable and to insure more people. When Beth reviews the plans she's offered under Obamacare, she notices they're all about the same and she doesn't get to choose much about her coverage. Her premiums and her deductible are higher under Obamacare than with her old plan. Obamacare also makes it so that young and healthy people like Beth have to pay more to cover the cost of older and sicker patients. This may sound like an attempt to be fair, but for Beth, it's a raw deal. Even worse, as insurance companies try to comply with the new rules, they have to look for places to make cuts, like restricting the doctors, hospitals, and drugs available to Beth and her family. Beth is frustrated. She feels like she's paying more to get less. Why couldn't she just keep her old healthcare plan? It turns out that, like millions of other people, Beth's old plan was canceled because it didn't cover all the services that Obamacare requires. Even though she knew it was risky, Beth thought about not buying insurance. But the creators of Obamacare knew that people like Beth might try to opt out of the system, so they included an individual mandate, which just means everyone has to buy government-compliant insurance or pay a hefty fine. Many of Beth's friends qualify for new government subsidies in which other taxpayers help them to pay for Obamacare plans. Others have signed up for Medicaid, which was intended to help the poor, because now they're eligible too. All this is also being paid by American taxpayers. Beth is glad to see that her friends are insured, but she is frustrated that she's being left out and the law significantly raises her taxes. Beth realizes that, rather than actually reducing cost, Obamacare just moves money around and adds more red tape to a system that already lacked much in the way of a real choice or competition. Beth is getting squeezed from both sides. She helps subsidize older patients through her increased premium, and she helps pay for subsidies and Medicaid for other people through her taxes. But who's looking out for Beth?